Our last section of men's health is going to look at abnormalities of the penis. We're going to look at cancer of the penis, phimosis, paraphimosis, and priapism as part of those issues that we're looking at. Your readings come mainly from your Iggy book, again, chapter 75. All the information can be found through those areas as you look at these issues. Now, as we look at cancer of the penis, it's very rare among men in the United States. Most penile cancers are epidermoid and are squamous in origin, and meaning they come from squamous cells. When we look at it, many times this is related to human papillomavirus, HPV. So if someone is sexually active with multiple partners, receiving that HPV vaccine is probably not a bad idea. That goes for men as well as women. So we do have something out there. We have seen a great decrease, and we see a decrease in women's with cervical cancer, and I think we could almost see a almost null cancer in the men with the penile cancers if we do away with that HPV. Now, these tumors tend to grow very slowly. They can develop anywhere on the penis, but typically occur mostly on the foreskin or the glands. When the cancers are confined to the skin of the penis, it's called carcinoma in situ, which you've heard of before. But it can also get down into the shaft of the penis and develop melanomas, basal cell carcinomas, and sarcomas. So those are more serious than when we start looking at the squamous cell. Typically, if we're talking about squamous cells, we can remove those cells without any issue. Circumcision, which is the surgical removal of the prepuce from the penis in infancy, almost eliminates the possibility of penile cancer because that comes from the chronic irritation and inflammation of the glands related to that uncircumcised process. But there is an ongoing controversy about neonatal circumcision. So one of the things we can do as nurses is, if you're taking care of a patient that is not circumcised, make sure you're teaching them about proper hygiene. Make sure that you're teaching them to pull the prepuce back so that it's not being constricted, and then pull it back over the glands once you're finished cleaning. Those type things can help take care of those issues. Now, if the cancer gets down into the shaft of the penis, surgical removal of the penis or sections of the penis may have to occur. When we do that, then you're going to have to look at the modification of the urinary tract for these patients. It's a very complicated, very in-depth surgery, and I'm not going to get into that for this. Just know that as you're looking at this, that human papillomavirus and that the circumcision probably can prevent the majority of cases of cancer of the penis. Then phimosis, the prepuce is constricted so that it cannot retract back over the glands of the penis. The prepuce remains down and around the tips of the penis, so basically now you can have an area for bacterial growth in that area, and you can get an infection. It also can cause decreased urinary flow. Those can be a big issue. So you want to teach uncircumcised men the importance of cleaning the area and making sure that they can move the prepuce back over the glands and putting it back down over the glands once they're finished. In paraphimose, the prepuce has not been returned to its normal position, so it's retracted back over the glands and now is forming a constricted band around the glands. This is constricting the lymph drainage, and it causes the penis to swell. Blood flow becomes impeded, and tissue death can occur as this. This problem is an emergency, requires immediate treatment, and typically that's taking them to surgery and actually clipping that area and going ahead and doing a circumcision at that time. It's not optimal because, again, you already have an infection going on, and as you're making incisions for those, it can put that patient at risk for infection. And again, uncircumcised males are the ones that are at risk for this. Causes can include infection, Not returning that foreskin to the original position as they should, poor hygiene, vigorous sexual intercourse, and penile piercings can cause these type problems. When you're caring for a man who's not circumcised, be sure to replace that foreskin down over the penis after bathing, or if you catheterize him or you're doing those, then that will help prevent those type of problems. Now, priapism, most of you know what priapism is. It's an uncontrolled, long-maintained erection without sexual desire. It causes the penis to become very large, very hard, and very painful. It affects the two corpora cavernosas, and without treatment can lead to decreased blood flow and tissue death to the penis. Stories from the ER, patients coming in that has been going on a long time. You actually, if this is going on, it's been going on a short time, you actually insert a needle and try to remove the blood from those areas. One of the nurse practitioner friends of mine was telling me about one that came in. It had been 6 hours, and basically they tried to put a needle in, and the blood had already coagulated. There was no way to actually fix that at that time. This patient ended up having to have the penis removed because of these problems. You see this talked about with the use of these Cialis, Viagra type commercials as you're looking at those. Typically that's the biggest problem that we see. There can be other issues that can cause that, certain drugs other than the phosphodiesterase 5 type medications, but again, it can be a medical emergency and needs to be taken care of quickly to prevent long-term damage. This concludes my lectures on men's health. Good luck on your exam on this section. We'll let you get to studying. Have a great day.